Assalamu alaikum. Dr. Hussain Bash Kolachi YouTube channel is welcoming you, and today we shall discuss the Eidul Adha related health problems, as well as we will see that what is in Pakistan, what is in Saudi Arabia and other countries, and how this global warming and heat waves are affecting the Eidul Adha are the one of the largest gathering in the Makkah by Muslims from 180 countries, and about 2 million people. They are performing the Hajj pilgrimage in Makkah, and they are facing the heat-related illnesses also. As per the newspapers, there are almost 500 plus people. They have suffered from the heat-related illnesses and they died, and many more were hospitalized. And this is the picture of the Saudi Arabia and Makkah, where the pilgrims, they are coming from the whole world in the month of Zil Hajj, which is the last month of the Islamic calendar. And Hajj is one of the biggest ritual in the Islamic religion. So coming to the next slide, you can see that the hundreds die from heat during the Hajj. Recent study had warned of escalating climate-related health risk in Makkah. Average by temperature in Makkah escalated by zero point 0.4 degrees centigrade per decade over a 40 years period as per the Saudi study. Then you can see that in Pakistan, also in Peshawar and in Punjab, more than 1,200 people were hospitalized and many suffered from the road traffic accidents and as well as from other gastroenteritis and other diseases. And overeating was one of the big problem in Pakistan. Apart from this, you can see that how the Eid is, which is sacrificial animals are sacrificed and a lot of meat is available. So people try to eat more and more to fill in their stomach. So that creates lots of problem. Another reason is that the sanitation is a big problem because the skins, bones, intestine, they are left by the people open in the streets, and there is a lot of smell as well as flies and other insects are there. They pollute the water and the environment. Ultimately, the Eid day celebrations become a sickness problem or public health problem. So in Pakistan, 1,200 people, they were admitted in the province of Punjab and Sindh. Data is not there, but they will not have such a big problem. But in Sindh and Karachi, the same situation is there, and in Balochistan is there because of its low population. So some figure may be low, but it is as bad as the Punjab, and the same is in the whole Pakistan. And then in Peshawar, 610 gastroenteritis cases were recorded. That is basically infection of the intestine and causes diarrhea, dysentery, were attributed to overeating and consumption of excessive meat. And sometimes they eat not properly and properly cleaned meat. Additionally, the hospital records injuries from animal collision and around 500 due to traffic accident. So look at the havoc of this. So apart from this, Eid is one of a joyful occasion of the Islamic calendar. So people, they are greeting each other, going to the Eid days, going to the gardens, going to the tourist places, meeting with their relatives, even the husband and wife, which are separated due to their professional activities, they arrange their visits. So their children, their houses are actually becoming a very active and very pleasant place. And the same is the parents, they get their children back And even there are certain marriage proposal, they are taking place during the Eid days because exposure of the boys, girls, families, it creates a lot of intimacy and goodwill also. Uh, some of the medical problems are our healthcare delivery system. The nurses are in short during Eid days. The doctors are short. Emergency care is not as optimal. So the hospitals, they are not giving as proper attention to the patients as in the normal days. And even this heat wave is affecting many people in a different way. They are working, time is short as well as they are feeling difficulties. Even I was told by one of the physician that they are not feeling comfortable. So the patient care is not giving a full attention. Sleep is disturbed. Even the comorbidities, they increase the hypertension, sugar, heart patient, they feel more problem. And this heat wave is giving a lot of trouble to the students who are preparing for their competitive examinations or upcoming medical MD CAT and Aga Khan test and NUMS test. So Dr. Hussain Bush Kolachi will provide you the relevant information and the uh, prevention of these problems is that the Eid celebration should be more hygienic, the hospital care should be more, even the awareness about the eating habits so that even overeating is reduced, and there should be no such panic during the Eid days that after Eid they will not get meat or anything. And even the cost of the clothes and other things, they disturb the poor people. But one thing is that on the Eid day, people wear a new clothes, take their baths, have a good combing and body cleanliness. They visit each other, they go to the Eidgahs. So there is a good hygienic side of the Eid and a good happiness side on the Eid. And even with little care, you can have a healthy, happy, and a fulfilling Eid. Dr. Hussain Bash Kolachi YouTube channel is welcoming you, greeting you, and those who have lost their life in Saudi Arabia. We sympathize with them. uh, the Dr. Hussain Bash Kolachi YouTube channel will provide you on public health, nutrition, health policy, particularly the admission policy in Pakistan, and even the students of the Kyrgyzstan, which returned with a very bad experience of beating there. We hope they will celebrate the Eid and they will continue, and we will request to the government of Pakistan that the climate change and heat waves, they should be part of their policy mechanism. So whenever there are climatic conditions or catastrophes, the government and the disaster management and other organizations should provide correct and helping information. We sympathize with the Saudi Arabia for providing lot of good efforts, but even then, if the climate condition, so they should upgrade their mitigation as well as health care and emergency care for the Hajis and next year. Another point is not only the Saudi Arabia and Pakistan are affected, but even the Paris and Olympic grounds are becoming hotter. And I will show you a picture of the Paris where the Olympics will take place. So you can see that the even the athletes, they will have a hotter ground and the climate. This will affect the sports, the enjoyment of the sports and the spectators. So you can understand that the climate change and the hot weather and heat related illnesses is now a proper entity. So a training and refresher courses of the doctors should be conducted in Pakistan and world over. And WHO and other organizations should take care of the climatic situations and their impact on the health delivery system. as well as the major gatherings, activities, whether they are religious like Hajj or Olympics, sports. With this, Dr. Hussain Kolachi YouTube channel is saying goodbye to you. Please subscribe, share, have your comments. And if you have found this video useful, then I think that this will be a great service from our side, from Pakistan. And we welcome all the YouTube friends and other social media friends. Thank you very much.